Good morning, everyone, and thank you for the good work so far. I've been checking out the boards with the draft conceptual frameworks, and you've already advanced really well. What I would say is that don't get frustrated by the process, okay? Because what might happen is that you have something which looks close to final, and then somebody notices something, and then you have to erase and restart. This is why we're encouraging you to use the whiteboard. Usually it takes a while to get to something that you feel more comfortable with, okay? While you're actually putting up the concepts and linking them, try to also start thinking about research questions at the different levels. So make notes. They might not be perfect research questions, but at least start thinking about the way you're linking the concepts and the way you're asking questions about them. Start jotting those things down. So we're going to start off with looking at study design in health policy and systems research and some of the factors that are important to consider when you're choosing a study design. By the end of this session, we think that you will be in a better position to know what the factors are to consider. You should be able to justify your study design and your methodological approach. And we're also going to focus on a very specific study design in health policy and systems research, which is called a case study design. And the reason we want to focus on case study, and then later this afternoon we'll spend some time on evaluation in Hpsr, and this afternoon we'll look at participatory research. The reason we have selected those particular study designs is because we think that most of you, because of your work and your studies in health research, you will be familiar with the more conventional types of study design, because a lot of you are coming from a medical or a health sciences background. So I don't need to tell you what an observational or an experimental design is, or a cross-sectional study or a prospective study. So we're not going to go into that. Yeah, we're not going to go into the basics of study design. We're going to talk about some specific study designs that are really important for the type of research we're doing when we look at systems and policy initiatives. So first we're going to talk about what to consider when you're choosing a study design. Then we'll do a little bit focusing on case study design. And we will then go through some papers and try to identify what study design is in question. Okay, so just bringing us back to the 8 steps of the research process and showing you where we are. Yeah. In terms of the cyclical process, we talked this morning about theory being not necessarily only considered at the outset of the project, but theory also influences your study design, and we come back to theory in terms of looking at our data and so on. So we're here still. Yeah, we have some tentative aims and questions, and these are informing our research strategy. Okay, we're actually a little bit ahead, so you guys are still working on your conceptual framework, but once you have questions is when you're going to move forward with choosing a study design. What we've covered so far, just as a reminder, I know we're only on day 4, but we've actually covered a lot. Yeah, we've covered some selected research paradigms. We have looked at priority setting. We've looked at the role of theory and concepts. We've done something on problem analysis, developing conceptual frameworks, and I did something with you on formulating research questions yesterday. So very broadly speaking, a research study design is a kind of a blueprint. Yeah, blueprint means when you think about an architect who comes up with a draft plan of the building, it's a guide, yeah, that translates your research question to a research plan. So in other words, it guides you in terms of saying, this is the site, this is the duration, this is the comparative aspect, this is the timing of the study that I'm going to be able to do that matches, that is well aligned with my research question. It describes both the nature as well as the structure of the planned research, And the study design itself has implications for the methods you choose, for your sampling procedures, your sample size, your analysis methods, and also for the ethics. Okay? Why would study design have anything to do with ethics? Any idea?
When we are trying to decide who our study population will be, it can become an ethical concern if, for example, we are including perspectives of a vulnerable population.
Yes, good. Anything else you can think of? When you're considering the field setting, for example? Yeah, go ahead. Anyone else?
Like study design can be depends on the time, like how much time we have, like to do this research. Suppose like if there is an emergency, like we need to do research, like we need to go for some cross-sectional study only. We cannot do cohort for long time. So that's what I feel. I think time constraints also it matters.
Okay, time considerations affect your study design, but in terms of ethics, ethical considerations. So you've already mentioned something to do with study population. Yeah, go ahead. That's Ashutosh.
Yeah, like for example, I want to do a study on end-of-life care, and my population interest is elderly people or people with tertiary, like who are in the end stage of their life. My interest is to interview them, but then I cannot do the interview to them because if I ask them about euthanasia, probably it might inflict an idea of euthanasia among them. So I cannot take them. So that might be an ethical consideration.
Okay, that's a good point, but that has more to do with the question than the study design.
Ethical considerations also come during the analysis part, wherein we cannot reveal the identity of the. Actually, ethics comes in several stages. Now, for example, after the data is collected and it is going to be entered, so the name and the contacts are not. We do the coding so that the identity is not revealed. Similarly, after the analysis, the pictures cannot be put out because ethical considerations come in there, where the identity of our participants are not revealed.
Okay. Okay, good. So you're all touching on generally where I need to build in ethical considerations, but I wanted specific to study design, and maybe I'll ask you this question again at the end, right? Because when you think about study design, you're thinking about my sampling strategy, my population, my site. So ethical considerations come in when you think about where am I actually going to do my field work? Where am I doing my research? Am I interviewing people who are managers? Am I actually going to do observations inside the clinic because I want to understand processes, which is a very different kind of ethical, that might entail different ethical considerations. Or am I doing community-based research? And, what's my population? What am I potentially going to encounter? So the study design in terms of the sites, the settings, the numbers, all relate to something to do with ethics. But we will discuss this much more in a separate session on ethics. So the key issues for the choice of design are, what is the problem I'm investigating? Okay, that already is going to give you some thought, how narrow or how broad am I pitching the problem, and what is the appropriate design for addressing that problem? The theory that is informing how I look at the problem, right? The purpose of the research. The purpose of the research questions, so the purpose and the theory drive the research questions, the methodological approach, the sampling strategy, Those are all things that I need to be thinking about when I consider the design. Yeah? So your design, when you choose it, I need you to be able to justify it in terms of it's the best fit for these components. So what are the key concepts of interest? So this is your starting point, right? And we saw in the examples that you were looking at that it took a little bit of time to get to the key concept you were trying to explain. So whether it was digital literacy or it was emergency care at the site, at the hospital for road traffic accidents, or the effectiveness of PPM, yeah? Those are all, those are concepts which you're trying to explain and research. How can they be operationalized? So for each concept that is relevant to your conceptual framework, you need to think for each one, how am I actually going to measure or assess it? Yeah, whenever I say measure, you probably think quantitatively. But essentially, how am I going to come up with a strategy that allows me to say something that is valid, that is going to reflect the reality of that concept? Okay, so going back to our example here, if I'm trying to assess levels of stress, the choice of a particular design is going to impact on my concept of stress that I'm able to tell you about at the end of the study. So theory obviously plays a part in this as well. If I take a predefined measurement of stress that's already existing in the literature, there are many conceptualizations of stress in the literature. That is one way to go about things, but I could also say, actually, I want to understand it more in its local context. I think some of these scales and some of these things that have been developed don't quite apply in this particular context, or they don't apply in this aspect of the health system, or whatever it is. The other thing that you're thinking about is what data sources are relevant. So when you think, okay, I can do this kind of work through a prevalence, by measuring associations in data that already exists, let's say in a quantitative data set from the National Family Health Surveys, that already kind of directs you towards a survey design, because you're saying that I can use existing secondary data to establish the relationship between, let's say, socio-demographic, factors that relate to access. And then the issue is, what is the most appropriate way of collecting the evidence? Yeah? And by appropriate, we could mean different things. We might say, what plays into appropriateness? Ethical, practical, feasible, yeah? And appropriate in the sense of it is the valid way of assessing this particular concept or concepts. Then the other thing is sampling approaches. So that's also going to be relevant for your study design. The last point is what analysis you can undertake with the data collected, which relates back to your purpose, and it can relate to theory as well. So these are all important things to consider. And sometimes we think about a study design, and then we go back and we say, well, actually, I'm not so sure this is the right study design, because I would like to understand a little bit more in a more open-ended way. And so then you change your study design. So the study design shouldn't be fixed right from the outset, okay? It should happen after you've thought carefully through what it is you want to measure and why you want to measure it. So let's look at some examples of study designs in health policy and systems research. So sticking with a positivist research paradigm and looking at the purpose of research. Yeah, so we've got 3 levels again. Exploratory, we're going to seek to explore a new area. Descriptive, we know that there's a problem, but we actually don't know very much about it. And explanatory, we're trying to understand how certain factors are contributing to the problem. Okay? So in your case, with all 4 of your topics, we kind of know something is a problem already, but we're trying to explain it, or we're trying to look at the factors associated with it. So generally for a positivist researcher, you will notice that for exploratory and descriptive studies, they would tend to use a survey design, okay? Because they, as a researcher, predetermine how they're going to measure the concepts that they're interested in. So the way to do that is you're using questionnaires, structured interviews and observations, or repeated surveys to measure things over time, before, after, or at certain given moments in time. But what's very clear here is that because this is a positivist starting point, you have already decided how to, that you can basically assess the concepts or the association across those concepts in a quantitative manner, most likely, okay? I'm trying to think if there is positivist research that is qualitative. That's sort of complicated in my head at the moment. Okay, but essentially you're looking at surveys, different types of surveys. A survey can include open-ended questions as well, right? But most surveys are pre-coded in the sense that you have a limited, either a binary response, a yes-no response, or they're categorical. When you're looking at an explanatory study from a positivist paradigm, you might have some sort of experimental or quasi-experimental design. So the design is still employing probably the method of a survey, but it's experimental in the sense that you're looking at a baseline evidence that you're trying to collect before an intervention was introduced, and then what happened after, 6 months post-intervention. So that is referred to as experimental, because you as the researcher have introduced something into a setting that changes the dynamic of that setting. Okay? But remember, from a positivist point of view, you think that most of the contextual issues influencing that process can be controlled. That's why it's called an experiment or an experimental design. Because you, quantitatively, you are going to be able to somehow, or that's what you would say you are able to do, you're able to control for anything that might be confounding the relationship between the intervention that you've put in place and the outcome that you're trying to measure. So that's in terms of primary data collection. In terms of secondary data analysis, so in other words, if we're looking at data sets, we might, if we're doing an exploratory study, we might be analyzing census data or record data, medical records, health systems records, program records, routinely collected data. But you could also be doing a quantitative content analysis. So this is where a positivist researcher could do something that sounds qualitative, but it's actually quantitative. How would you do a quantitative content analysis, for example, of media reports about a certain topic, about road traffic injuries? What would it imply to do a quantitative analysis? Yeah? What do you think? Taking the statistics from the reports.
Or maybe looking at newspaper reports from an angle of how many accidents are happening, in what time, sort of. Somewhere.
Okay, remember the content analysis of media is you're not treating media as data. I mean, you're not treating media as an accurate representation of your phenomena, but you're doing something else. What do you do when you do a media analysis? Why are you interested in the media? What does the media offer to you that a data set doesn't offer? Okay, let's say we're looking at road traffic injuries and debates around, where we should situate our emergency care facilities. Why is the media interesting? Yeah, but is the media objective? Yes or no? No. So if the media is not objective, why do you want to look at it? What does it give you? Perspective? Yeah, perspective of who? People? Yeah? Okay. Okay, so let's say I really want to understand how media is shaping public perception of priorities. Okay, so I'll give you an example. What we were looking at in Uganda some years ago is we were looking through the media to see how the public response to the enforcement of infection prevention control measures during COVID. So we basically did a content analysis, but the first analysis was actually quantitative. In other words, we looked for specific words and we counted them. How many times was this mentioned, right? Or and then we started to analyze what kinds of words were used in relation to this topic. Still very quantitative, it's not qualitative. Yeah, because you're assuming as a positivist that the number of times something is mentioned gives you an indication of the strength of the topic, or maybe something about the interest in the topic. So you can imagine somebody doing the same thing on Twitter, whatever it's called now, X, and on social media. Okay, people do analyses of the content of social media by counting, literally counting the number of times certain themes come up. Okay, so as soon as you move into quantification, you're still using a positivist approach because you're saying that numbers matter. Okay, so quantitative content analysis could be even with speeches. If you're looking at, presidential directives or whatever, prime minister's speeches, and you're analyzing the content. You could do it in I think it's again the difference between inductive and deductive. If you already decide, this is what I'm looking for, how often in the speeches is, a particular concern mentioned? The impacts of, or mental health. How often does mental health come up in kind of discussions, high-level discussions of health in the country? Okay? So yesterday we were talking about prioritization of topics. So imagine that one piece of research would be to gauge the public sentiment in terms of looking at media to understand what seems to be coming up, what is reflected as priority topics in the media. Okay, so don't take that at face value because the media is always reporting on things in a certain way, right? Sorry, there seems to be an issue with the thing. Okay. So the other kind of design that we're looking at is explanatory. We said experimental and quasi-experimental. And the type of analysis that we're doing there is simple, univariate, or multivariate analysis and modeling. Okay? So that's very typical with any kind of survey data, any kind of quantitative analysis that you're doing. Obviously it's more sophisticated, but essentially you're looking at both frequencies of a phenomena and you're also trying to assess associations between two or more independent variables with a dependent variable. Okay? Moving to a relativist paradigm. Again, thinking about exploratory, descriptive, and explanatory studies. If you're doing an exploratory study, you're exploring a new area you don't know much about, okay? This is where you might use some form of fieldwork or ethnography for primary data collection. You may not do in-depth ethnography, but you might use some kind of open-ended qualitative research because you're exploring. You do not know the categories of interest fully yet. And sometimes the people themselves who you're working with can be involved in this kind of research. So Solomon is going to speak about participatory research, which is a particular type of research where you're trying to engage research participants themselves in the research. So there's a form of that called autoethnography, which is where you give people diaries or you give them cameras or whatever it is, and they record their own experiences of whatever it is that you're looking at. You could also use a case study, which is what we'll talk about later. In terms of secondary analysis, we're going back to content analysis, but this time we're doing qualitative content analysis. So that means we're trying to understand and interpret the discourse, in other words, the themes as they relate to a particular theory, right? So, for example, I'm reading through policies, guidelines, minutes from meetings or from the media, and this time, instead of just counting numbers of times mental health is mentioned, I'm actually looking at how mental health is being discussed. And I am doing some kind of thematic analysis where I say that, okay, the way the topic is being prioritized or the strategies that are being prioritized are reflected in these documents through different rhetorical means. Rhetorical means the way that people speak about things. Yeah, the way they give weight to some things but not weight to others. The forcefulness, the style of speaking, the style of the way these topics are written up tells you a lot about how people are, setting priorities or discursively discussing these topics. I might also use some kind of historical analysis. So you can imagine that I'm exploring a topic. I want to understand, for example, how a policy came into being. What's the history behind the policy agenda setting? So I'm going to analyze draft guidelines, and I'm going to look at historical records of the last 20 years that led up to the HPV vaccine being launched. Yeah? And I'm not just counting there. I'm actually analyzing what became important at what point in time. Who were the major actors? What were the events? What were the decisions taken? Yeah? So those are things that are only addressed through different kinds of qualitative work. Descriptively, we're also still using case study and ethnographic designs. We're focusing a lot on less structured observations and interactions. So you can imagine that you, in order to really understand the dynamics of whether the CHOs are being integrated or not, you could interview them, but actually they're going to be pretty anxious about talking to you about the tensions that they're facing. So probably the best way to do this study is to be there and observe what's going on. And you might say, well, that's going to be very difficult because if they know I'm a researcher in there, then everybody's going to behave differently. But we know that from the literature is that basically people settle back into their usual behavior very quickly. So that if you can spend even 3 days inside immersing yourself in their life world, you'll be able to say a lot about their relationships, their interactions, the tensions that they might have, right? So descriptive is at the level where you're describing something that you have already an idea might be a problem that's driving your question. Explanatory, again, case studies, theory building, longitudinal. Longitudinal just means that you're able to spend a longer period of time in the field because you want to document change or process. Grounded theory refers to, it's not so much a design approach, I would say. Some people consider it a study design approach. I think it's an analytic approach. But basically it is a way of really allowing the data from the field to inform your theory. So there's two different ways to approach analysis. And I always get this mixed up, but one is where you start from the theory and you allow your theoretical lens to shape what you see, and the other is you try to observe in an open manner and you allow that then to inform your theoretical ideas. So you could be using some sort of semi-structured qualitative methodology. But essentially the big difference between a positivist researcher is that they preset the categories of what they're trying to measure. And often that is through a survey, a classical survey design or an experimental design. And in this case, we're looking at observational designs that are mainly qualitative in nature. The second thing you want to think about when you consider study design is whether the design is fixed or it's flexible. So in a fixed strategy, it means that you have to pre-specify before data collection. So data is generally numbers, and it's generally quantitative data you're looking at. You rarely are collecting qualitative data if the strategy is fixed, right? Which means you've prepared the survey tool, you've decided how you're going to measure stress or whatever it is, and you go into the field, you conduct the survey. You can't change midway through. It's a fixed strategy. Yeah, in fact, you would be corrupting the quality of the data and the study if you changed your questions halfway through, right? In a flexible strategy, your design could evolve in the course of data collection. Can you give me an example of why your strategy might evolve if you're doing, for example, an exploratory study, and your idea is to do some qualitative interviews to understand a phenomenon, let's say your topic, okay? If you're trying to understand integration of CHOs in the health system, why might you start with one angle but end up 2 months later with something different? Why do you have more flexibility in a qualitative study? What's happening as you're observing?
As in qualitative study, we are like while starting qualitative study, of course, we have some research questions in our end, but like while doing some interviews and all, like we don't know what kind of data we are going to get. Like as soon as they are probing through we are going through the data collection in the qualitative study, like we may get different type of insights. So that makes us to go in that way. Sort of.
Yeah, good. Okay, so a qualitative study, let's say you do the observation of 2 months and you say, oh my goodness, there's something we completely missed. In fact, it has nothing to do with tensions, it has to do with financial incentives. And those financial incentives are, even though on paper they're the same, but under the table there's something else going on. But we've only observed it after spending a month in this setting. So now we're going to shift in terms of our strategy, and we're going to be asking a little bit more in a very diplomatic way about the kinds of ways in which these incentives are distributed. Okay? So that strategy is flexible because it allows you to start changing your conceptual framework and developing it and refining as you go along. It's a flexible strategy. Fixed strategies are primarily associated with positivist research, because as a positivist, you've already predetermined what you're going to measure, you've already decided there's no way you can change that. A flexible strategy is generally associated with a relativist, a realist, constructivist approach, because you're assuming that the nature of reality is not predefined by the researcher, but it is something that you are still in a haze about. You still have a fuzzy idea about. And you're only going to sharpen your idea of as you conduct the research. So the overarching study design types in terms of fixed strategies are experimental, quasi-experimental, or simply cross-sectional, right? A descriptive prevalence survey, a cross-sectional survey. Or in terms of secondary data analysis, you might be using that data to do some sort of modeling. So if I introduce this intervention, what is likely to happen after 5 years or 10 years? Whereas your flexible methods are case studies, grounded theory, ethnography, life histories, secondary data analysis. You might be using archival analysis or discourse analysis. But essentially the reason is because as you're moving forward in the research, you're learning more about the topic, and your initial theory, your initial ideas are changing. That's why it's flexible. Yeah?
I had a doubt. So when we're talking about experimental or quasi-experimental study, doesn't that sort of delve into operational or implementation research? Because we're essentially trying to put out an intervention and see how that pans out. So how do we make that a health systems research?
This is all still part of health systems research. Okay. We're not saying this doesn't exist in health systems research. We're just saying be very clear about whether your strategy is fixed or flexible, and be clear about the things that inform how you're going to assess the variables you're looking at. So in a very, let's say you're doing an intervention study. So we're going to talk about this in terms of evaluation. If I am introducing something that I think is simple, okay, so I think it's simple, it's very different to say, I'm going to change the regimen of these people who are on treatment from 9 months to 6 months. And I'm going to assess whether this made a difference to certain indicators, you know, whatever it is. Reduction of associated side effects, morbidity, Okay, so that is positivist. And that is also associated with something that is relatively simple, because I introduce this treatment, I'm able to assess the effects, etc. But if I'm introducing as a health systems intervention, and I say, how ready is the health system to administer this new drug regimen? That's a different question. Why is it a different question? To ask, is my drug regimen making a difference to individuals who are suffering from this condition, versus is the health system ready to administer this drug regimen? What's the difference?
So in the second one, we'll be looking at all the associated factors for the readiness of the health system.
Such as?
Health workforce, but financing, service delivery, how are they going to deliver that regimen? Whereas in the first one, when you're talking about individual, we are focused on how that drug regimen is going to affect that individual's status. Yeah.
So very good. So this is exactly the point we're going to be discussing a bit later, which is that in principle, I mean, crazily enough, sometimes when you're looking at the effectiveness of some new vaccine or, you know, new therapeutic regimen, etc., and people say, we've gone through the trials, we know this is going to work, but they don't think about what happens if you try to implement it in a real life setting. And so that's where the health systems research comes in, and that's where you can say, I will do an intervention study, but my intervention is actually a complex intervention, because putting in a new regimen, do the health workers believe that this is more efficacious? Does the patient believe that this is more efficacious? Do I have, you know, does it make sense from the organization of care point of view? Is that drug, you know, or whatever, is it going to be available? What happens if there's stockouts? Do I put people on the old regimen, etc.? So there's a whole bunch of operational questions that come in. Yeah? So in principle, we tend, just remember that even if you're talking about an experiment, in the health system sense, your experiment is one that includes a lot more many factors that you have to take into account in the research. All right? Okay, so in terms of the flexible strategy, we're looking at case study. Yeah, we mentioned life histories, and yeah, I think we're done on this one. Good. Okay, sometimes you'll say, well, I don't want to use just a fixed strategy or just a flexible strategy, but I want to combine the two strategies. And a mixed methods design is when you combine. Why? Can you imagine why you would combine two designs? Why might you have, let's say, you say, I want to do a cross-sectional survey, and then I want to do some life histories. Can you imagine a study where you would do that? Mm-hmm.
The quantitative findings is more generalized. So if we do both the methods, so we have it can be exploratory type or it can be an explanatory type, like starting first with qualitative, then going for quantitative, or starting first with qualitative, then going for quantitative. So it supports each other.
Okay, but is the aim of qualitative work to be generalizable? Is it a shortcoming of qualitative work to not be generalizable, or are we aiming for something different?
No, like some of the research questions cannot be answered by a single method. Like we cannot go into the like just like qualitative or just to the quantitative. The research question itself making us to go for like we need both perspective. Like we need to do some interviews. We need to go into depth into it. And on the other hand, we have some data or like quantitative data, so we can get like we can combine the both the like qualitative and quantitative studies, like whatever the results get, then we can come to an inference or conclusion. So that makes them like.
Okay. Okay, good. So basically, be careful with the issue of generalizability, yeah? Because actually, different kinds of design have different types of logic, yeah? They have a different intent, and they have a different purpose in terms of your research. So when you mix methods, you might be doing a survey in the beginning because you say, I just want to measure what is the burden, what is the severity of this issue? How many health workers in my facility are unhappy with their working environment, with their conditions? And then I want to know why, right? Or vice versa. You want to go in and you explore first, you do some interviews, talk to managers, you observe a little bit and you notice something's up here. So now you've decided, okay, there's some levels of dissatisfaction here which are connected to the career progression possibilities. So you're now starting to conceptualize the issue, and now you're going to go back and you're going to do a survey. But the survey is informed by the qualitative research. So you could do it either way. So this is where you have a mixed methods design. So in other words, you could be using a survey design for part one, and the second part might have a more flexible strategy where you go into case studies, multiple case studies, because you also think that there's differences in this issue across the country. Okay? All right. So you're often triangulating. Triangulating means you're using two or more sources of data or sources of evidence or methods. You're trying to capture different dimensions of the phenomena in question. Okay? So remember also, sometimes people think triangulation is to you triangulate methods because one method might give you an incomplete picture, whereas another method gives you a complete picture, and therefore you're trying to correct your reality, your portrait of reality. That's not the case. What you're doing, it is most likely that a survey and a qualitative design are going to give you different kinds of information, and some of it may conflict, but the conflict should not be for you an issue that, oh, why am I getting different responses from the qualitative information? In and of itself, that's interesting. That suggests that it's because of the way I'm measuring this concept. If I measure stress through a standardized scale versus speaking to people, the type of information itself is different, and you need to grapple in terms of the analysis with those differences, right? And we said you can sequence this according to the logic of inquiry. So you could do something that is more quantitative initially and qualitative later, etc. So this also suggests that you don't have to be fixed in terms of your research paradigm, right? Because you could be incorporating different elements. Okay, so now we're going to focus just for a short time on a specific type of design, which is called a case study. Now, case studies, it's very, very confusing, I have to say. And the literature, because the reason is we use case study all the time. We always, we find reference to case studies in the literature, in the media. We talk about, oh yeah, I'm doing my case study in Kenya and I'm doing mine in India, okay? So what I'm going to tell you today is how this term is being used in research, okay? And it is not what you think it is. In some ways, but it is, I have to say, it's still a source of confusion across researchers. What is a case study? So generally it's an in-depth, contextually rich investigation of specific health policies or systems issues within a real-life setting. All right, so a case study always involves immersion into that health system into the reality, the real life world of those managers, those providers, the clinical community interface. It's seeking to understand how and why sort of things occur within a complex system, rather than just measuring outcomes. Okay? So your case study approach might happen after you have realized through some kind of survey that there is some issue that should be investigated in depth. And in health policy and systems research, it is very useful to use a case study design because you want to investigate these multiple that you're already starting to outline, interacting contextual factors and social processes. So in other words, if I look at your diagrams already and I said, they're raising a whole bunch of different questions, you might get very fragmented, right? In terms of saying, oh yeah, I need to do a survey for this one, and then maybe I'll do some interviews here, and but you could do a case study, which allows you to capture the phenomenon that you're interested in, digital literacy, in a comprehensive way by using different methods. So on the right-hand side is a nice series of case studies, which I copied a link for you on, but they were actually developed by an organization called Hpsr, which is I think a South African, Indian, Kenyan collaboration, if I remember rightly. And they produced a series of using case study design, cases to look at, and they're quite short. They're a few pages each, but it's really a good reference to understand a bit better what these look like. So it's an established research design that you may have heard of in anthropology, in sociology, history, but also law and medicine. Think about case studies in law, or even a case study in medicine, where you have an article that's written up about one specific patient because they present some kind of configuration of symptoms or issues that are of importance or relevance to the field. They're also used in social work. We talk about case studies, right? Often you're integrating multiple data sources, so both quantitative and qualitative. So for example, you're looking at policy documents, you're looking at interview data, archival data, observations, and so on. They could be a single case study, or it could be comparative, where you're looking across cases. So here's an example of a comparative case study: implementation of promotion and prevention activities in decentralized health systems, comparative case studies from Chile and Brazil. Okay? Now, what is important here is that in this methodology, in this study design methodology, Chile and Brazil are not the case studies. It's not the geographic location. It's the phenomenon of interest. All right? So here you might say it's promotion and prevention activities, or it's about decentralized health systems. But this is one source of confusion, is that people often think of the case study as actually the country setting, or the location, the geographic location. It's not the geographic location. So we use case studies to explain, to describe, explore. So all those things that we have as the intent or the purpose. Phenomena in the everyday context they occur. It helps to understand and explain causal links or pathways that result from a new policy initiative or a new intervention. It lends itself to capturing information on how, what, why, such as how is the intervention being implemented and received on the ground. And it also offers some additional insights into what gaps exist in its delivery and why one implementation strategy might be chosen over the other. So here we go. Defining the case is one of the first steps. The case can be an issue, it could be a solution, it could be an intervention, an organization, a community, an occupation, or an individual. But one thing that's clear is that the study object, the case, is always related to people and interpretations of the social actor's perception of this phenomenon. Okay, so it could be more concrete if we're looking at individuals. So life histories are often used to capture kind of individual level case studies about people's experience, for example, of living with a particular condition. Or it could be a specific organization. So I'm looking at, let's say, peer support networks for people living with some chronic condition. So my case study might be those peer support organizations, or it could be less concrete. So it could be an event or a process or a decision. Okay, so we'll come to some examples in a minute. Individuals, what's very important is that they're studied in a natural environment. It's not experimental in any way. It is the real life natural environment. It is not the geographic location. So usually, in order to decide on what case we're interested in, these are very, very much driven by theory and theoretical assumptions. Because when you decide on a phenomenon of interest, you are suggesting that that focus is going to shed light on something that you want to understand. So like we took before, we said a case study could be a peer support network for people living with, I don't know, cystic fibrosis or something. You have decided already, you have a theory around the importance and the role of peer support, and you think that it differs, let's say across countries or even across states, depending on whether people think that that is a therapeutic mode that helps them with deal with their condition. And the reason I'm saying this is because not everybody thinks peer support is the way to go, right? So when I did work on HIV back in the 90s, I looked at the role of peer support networks, therapeutic sort of, support groups for men living with HIV. And I noticed that in the country I was working in Canada, Canada's divided into French-speaking Canada and English-speaking Canada. And this was very interesting to me to note that for the French-speaking Canadians, the idea of peer support or sitting together in a group and discussing your problems and discussing your strategies for treatment seeking was something that was not very common. People said, the more I speak about this, the more sick I feel. I don't want to share this. This is a private thing I have to go through. Whereas for the English Canadians, who were more oriented towards the United States, where they're much more into peer support, therapeutic value of talk, they said, the more we talk about it, the stronger we are. So it was a very interesting case study for me, not so much about English versus French, but it was about peer support networks and their value in terms of dealing with HIV at a time when there was not much therapy or therapeutic options available. So you identify the theoretical assumptions. In other words, the assumption driving this was that peer support helps people deal with a condition, a long-term condition. You then define the case. So what is it? What is my case? It is this notion of peer support or the peer support network. And you select your cases, right? Because you can't study absolutely all peer support networks. You're going to have to find a particular type, and you're going to have to compare like with like, for example. Then you collect your data, you analyze your data, you interpret it, and you report findings. So it's important for Hpsr. It's a very important, an important approach because it allows you to capture complexity. It explores how and why. It allows contextualized learning, yeah? Because a case study approach is often something that is, you might say, well, it sounds like it's very restricted to one country, but a case study approach, if it's really well done, is something that is very useful to think about how you would replicate it in another country. And it also helps you understand why something, a peer support network, works in one context but not in another, for example. And it supports theory building, yeah? Because you can generate insights for broader health system strengthening and reform. Should we use peer support networks throughout the world for supporting people with HIV or with chronic disease? So coming back to those resources from the website that I mentioned, where you saw the cover page, these are the 3 case studies that are covered in these teaching case studies, which I would suggest that you look at. The first one is the marketing of alcoholic drinks in South Africa. This is covering the period 2011 to 2017, and it's exploring the process through which the draft policy, control of marketing of alcohol beverages, was formulated. So it's a case study in policy formulation. Yeah. The second one is about health systems decentralization in Kenya, focusing on early stages of decentralization of government functions that occurred after Kenya's 2010 constitution, to look at how the changes affected the local level system and service delivery. So the case study here is decentralization of government functions. Yeah. And the third one is back to South Africa, and it's looking at routine functioning of local level health system and the ways in which middle managers and frontline staff have sought to cope with their challenges and do things differently to improve the health system's functioning. So this is probably a meso-level case study because they're looking at mid-level managers. So in this case, the case study is focused on a specific cadre of management. Okay, so it sounds like it's complex. It sounds like it is a how do you say, something that combines a lot of different ideas that we've already discussed. But I think it is something that's very commonly used in health policy and systems research. Okay? Right, we're going to move to our favorite exercise, which is to look at papers and try to identify the case study. I mean the study design, sorry. Okay, so bearing everything that you've done so far, let's look at a couple of examples and then we will conclude with this session. So here is a study, social factors associated with trust in the health system in northern Sweden, a cross-sectional study. What is the design here?
Cross-sectional study.
Cross-sectional study, absolutely. It's right there. If I did not show you the cross-sectional study part, is there any way you could have known what kind of design this was?
You could have guessed like factors, but not sure. Can't be sure about that.
Mm-hmm. Good. Okay. So the fact that if I had left off the second part, you would have social factors associated with trust. The clue is in the associated with, because that kind of points you in the direction of, okay, the factors, they must have somehow operationalized them, and then they must have looked at them quantitatively. But not necessarily the case, because it could have been a qualitative study where they ended up looking at, how social determinants of trust in the health system. Okay, so looking at the abstract, research on trust in the health system in the Swedish context is limited, etc., etc., etc. The studies have shown that lower levels of trust in the Swedish system were associated with being a man and of younger age. Additionally, the Samu indigenous population and immigrants have reported less trust, and so on. So then you're looking through, there's a better need, this is the introduction, yeah? There's a better need for better understanding of social factors influencing trust. Especially important, the aim was to explore the level of trust and to assess socio-demographic and social capital factors associated. Okay, that's already kind of giving you a little bit of a sense that they have some ways of measuring, probably quantitatively, socio-demographic and social capital. So the theoretical concepts of interest, what are they? What is being assessed here? Trust. Yeah, trust in the system. Good. Right? And social factors influencing trust. Aim of the study, where is that? It's in the bottom, yeah. Exactly, yeah? Okay, study design considerations. The Health on Equal Terms is a cross-sectional survey that aims to follow people's health and lifestyle over time, including physical and mental health, healthcare visits, dental health, drug consumption, and so on. So this is still the same study, by the way. Then they're talking about areas of Sweden. We used HET 2014 since the most recent questionnaire lacks the outcome of interest, trust in the health system. Using the Swedish population register as a sampling frame, Okay, now you're already getting much more clues, right, about the design. So, health on equal terms, cross-sectional survey. So they're using cross-sectional survey data. It's a fixed strategy, repeated over time, yeah? It is conducted, it says, since the most recent questionnaire. So we know that it is something that is being conducted every so often. Fixed strategy. Okay? And the data set was linked with register-based individual data, including education level, occupation, income, civil status, and place of birth. So this gives us clues that it was a closed-ended survey. It's a very large sample. And it's quantitative analysis of associations. Okay? So all of these things indicate to us that it is a positivist stance. It is a fixed strategy. And it is it descriptive or is it explanatory? What do you think? Descriptive. Yeah, I would agree, it's descriptive. Okay, good. Okay, let's look at another one. The resilience of 2 departmental health insurance units during the COVID pandemic in Senegal. Okay, so conceptual approach and study design. The conceptual approach of this research is part of our analysis of the concept of resilience and the analytical framework applied in several countries. In our study, resilience means UDAM, I think that's the unit, the health systems unit, ability to cope with pandemic shocks, absorb, adapt, or transform to maintain and improve access for its members, and so on. We sought to report empirically the context of the pandemic as perceived by the people concerned, its effects on individuals, and the strategies deployed to deal with it. This is what we've named as configurations, drawing on the use of this concept by sociologists of organizations or evaluation. Configuration is the set of different forms of interconnected elements or natural cluster. In this paper, we define the configuration around the resilience analysis framework. What kind of study is this? What's the purpose of the study, first of all? Yeah. Yeah. Okay, analyzing resilience of the health system, that's the purpose. And they're looking, this is the main things that should give you clues. So what kind of design do you think they used? Qualitative? What kind of paradigm? There's a couple of clues here that give you a sense of the paradigm. Configurations. Configurations, sets of different forms of elements.
Relativism.
Realist, absolutely. Well done. Theoretical concepts of interest, concept of resilience, right? And configurations. Okay, methodological strategy we used was a multi-case study with several levels of analysis. The cases are the only 2 UDAMs, I think that's a unit, as I said, existing in Senegal at the time of the study. Levels of analysis correspond to conceptual dimensions of the resilience configurations. Analysis is based on empirical, retrospective, qualitative research, document review, individual interviews, field observations. Okay, so study design is multi-case study design. Okay, it's a case study design. Okay, because they're defining cases. Okay, data sources are here, right? Documents, individual interviews, field observations. And this also is showing you after exploratory analysis at the beginning of the pandemic, we wanted in-depth empirical data. So they did some exploratory work and then they came back to it. Okay, it's not about salary, a discrete choice experiment to determine community health worker motivation for work in Nigeria. What kind of study design? Is it observational or experimental? Okay, okay, do you remember what a discrete choice experiment is? I mentioned it briefly just the other day. Okay, when I'm trying to find out what is going to keep my health workers in post, what do I try to do? What method might I use? Okay, it's basically a way to find out what people place value on in terms of incentives. Okay, so it's an experiment where they're given a range of options. What would make the difference that you would be more likely to stay in post? Is it a top-up of your salary? Is it a chance to graduate to a different degree of health cadre? Is it education for your children? And they vary the mix and the levels. So it's very much in line with those control knobs framing. And then they do, you answer lots of questions, and there's a kind of quantitative way of then deciding on what the best incentive package would be. So, I think there's some words missing from there, but although there are no Nigerian DCE, discrete choice experiment studies focused on health workers, community health workers, several studies have been conducted in other countries. Given the importance of CHWs to the Nigerian health system, we sought to identify contextual factors that drive job preferences through an experiment. So the purpose is we sought to identify, right, this. Theoretical concepts of interest. What is the theoretical concept here? What are they trying to explore? Motivation, right? And quality healthcare. Okay, so it's both motivation, factors of motivation. I would say it's more motivation. I think motivators. Okay. We conducted a DCE to assess preferences. Data sources, let's see what the data sources are. Okay, the data source is a discrete choice experiment. The analysis method is here. Okay. Okay, so I'm going to stop there. That gives you a little bit again of a sense of how you go about really thinking about study design. Is we were looking at a couple of different considerations. What's the purpose? Yeah. What is the construct of interest? Is it a fixed strategy or a flexible strategy? Is it in-depth or is it one-off? Is it cross-sectional? Am I capturing something at one moment in time? Or am I looking at 2 periods of time or more? And am I trying to capture something in its comprehensive, holistic sense? Or am I just looking at one isolated phenomena? Okay? So this is something that you will be doing in your funding pitch, is you have to identify an appropriate study design for your question. Okay? But I hope this has started to give you clues. And this is not so easy or straightforward, so don't worry, it will sink in again. Remember that when you sleep on it one night, you always know what it's all about the next day. All right? Okay, so we're going to stop now.